Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast. Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Today, we're exploring the crucial role of how to communicate the importance of periodontal treatment to our patients, especially when they're resistant or hesitant to move forward with their care. And we often run into this. This is not due to one practice or another practice. This happens all the time, all over the board. So don't feel bad about this. We're going to dive into ways to help you communicate better with your patients and to have your patients increase their understanding. So patients don't fully grasp the severity or the connection to the overall health and periodontal disease. And our task is to guide them through understanding why treatment is not just necessary, but essential for their overall care. But we have to do this very gently, and sometimes we'll explain it the one time, and patients may not get it. They may need to think about it, and they'll come back for their next cleaning and visit, and they may not get it again. We may have to review this a few times before they fully understand. I don't want you to get discouraged. I want to let you know every opportunity that they come back is a new opportunity to help them to learn and to guide them to help. So here are a few tricks and tips that I've used that have really helped me, and I hope they help you as well. So when I bring a patient back, the first thing that I do is I look at their hands. And what I'm looking for is if they have any signs of arthritis or any signs that they can have difficulty, what that might make it hard for them to clean their teeth. It's a subtle but yet a very effective way to assess their ability to take care of their teeth at home. This gives me a great indication. And the next thing I do is, as I'm walking them back to the treatment room, is I listen to their breathing. I want to see if there's any signs of respiratory distress, if they're having asthma, if they might have a COPD. I'm looking to see and observing what's going on in their breathing pattern and how that might shape our conversation to their oral health needs. So I'm assessing them even before we enter the dental treatment room, because I want to understand what their needs might be better, because when I know their needs, then I can address them better as a healthcare provider. Then this one is huge, is a thorough, comprehensive health history. I know we're busy, but this can be done very effectively. A lot of times I just ask them if they have any new conditions. And often we get that, no new conditions. And then I dive a little deeper and I'll ask, have you been diagnosed with any lung condition or any diabetes? And I wait to hear what they say. And then I ask them about their heart. I usually choose 3 items to speak to the patient about, but I try and recognize if it might be a muscular issue with their hands or respiratory with their breathing before I bring them back. So that way it lets me know what questions I can hone in on to help relate to their periodontal disease or health of their mouth. So from there, if they say, no, I don't have any of those, I ask them about their family history. Do you have a history in your family of heart disease or asthma or any other conditions we can know about that are hereditary? And this helps basically get the dots lined up so we can talk about periodontal disease, because we all carry that baggage of our DNA, of what we inherited from our family, and we can't change that. That's just going to be there, and that will affect our overall health, but it'll also affect our oral health. And then I review their medications. A lot of times I'll ask them or tell them, I have down here that you take 4 medications. Is that correct? Sometimes the patients are like, I don't know, let me think. And then from there, I tell them, all right, this is what I have now. And it helps me to get an accurate health history of conditions, but also medications. Because then from there, I can decide where's the best way to take this conversation. So I bring everything together and I explain how periodontal disease will increase the inflammation throughout the body, which is particularly concerning for the condition that they may struggle with or
they have a family history with. So I let them know that with diabetes, it increases the A1C scores. It causes them to have a higher spike, if you will, in their blood sugar levels. And I want to emphasize to them also the heart disease, and that the bacteria in the mouth is the same bacteria around their heart. I want to help them understand that there's a connection, and I want them to be healthy. And a lot of times I get their attention with this. Now, if they are like, no, I don't have any diabetes, I don't have any heart conditions, I'm fine with my lungs, I let them know research says as recently as 2023, there is an article by the ADA that says that periodontal disease is around 30 to 50% hereditary. And I let them know that's just a fact, and it's hard to escape our DNA. So I let them know that that's why I'm asking about their family history, because it helps me to know how to take care of them better. When I show patients that I'm their advocate, that I'm there to help them, and that I'm clear and I show compassion, patients move forward. And I let them know periodontal disease doesn't just stay in the mouth. It travels throughout the body. It increases inflammation throughout your entire body and can be very harmful to your body. And this helps patients understand and learn, and they have that opportunity to reflect on their overall health. And I want to build trust. I let them know, I want you to think about this, do some research yourself. Let's speak about this again if they're not ready yet to move forward. But a lot of times, as I talk to them and explain the situation of the overall health of their mouth after I do the full mouth probe and the x-rays and I gather all that information, I let them know this is what I'm seeing. And patients want to be healthy. Most patients aren't going to tell you, no, I don't care that there's disease all over my body. Leave it. I'm fine. I like it. That's not going to happen. Patients, when they understand and you give them that opportunity, like if they're not ready to buy into it yet, let them know, please research this yourself. Come back. I'll see you in a month or 3 months or whatever it is. And let's talk about it again, because more than likely, this is not going to get better. It will only get worse. And I want to keep you healthy. When you come from that place of educating, showing compassion, and building trust and relationship, patients may not move in right away, or they may jump in right away because they recognize your concern for their health. And that's why we're there as healthcare workers. Too often we forget why we're there. We get all consumed with making sure we've checked all the boxes and we've done the full mouth probe, we've taken the x-rays, we went over the health history, we got our scaling done in 20 minutes and polished, and is there anything else going on in their mouth? But I want you to make sure that you take a few minutes to educate your patients about the overall health, the oral systemic link, and build that trust, build that care, because it will have a huge impact on your patient's health, but it'll also help your practice to be healthier. And that's why we're there. We're there to have healthier patients and help our patients be healthier. And when we take this moment to really assess the patient and get the proper health history and assess their breathing, their hands, and a proper medication list, we speak to them as an individual instead of making this broad imaginary thing up in the cloud, if you will. We want to make it specific to them. And when we make the disease specific to them about the oral systemic link, if they have a heart condition or a breathing, a respiratory issue, or even Alzheimer's, it helps the patient understand how we're there to help them to get to health. Thanks for joining me. Have an amazing day.